Hello everyone.
Hello. You are late today.
Sorry guys for coming late.
It's okay. Now shall we continue the next essay question? Sure, shoulder joint is today's question.
The shoulder joint is the synovial joint, of ball and socket variety, between the scapula and the humerus. It is also known as multiaxial joint. It is the most mobile joint of the human body.
Can you say me its articular surface? The head of the humerus articulates, with the glenoid cavity of the scapula.
The head of humerus is larger than the glenoid cavity, hence there is more possibility for the dislocation of shoulder. Can you say me its ligaments?
Capsular ligament, and glenohumeral ligament, coracohumeral ligament, transverse humeral ligament, coracoacromial ligament. In the shoulder, the joint capsule is formed by a group of ligaments that connect the humerus to the glenoid. These ligaments are the main source of stability for the shoulder.
Glenohumeral ligament connecting the humerus to the glenoid fossa. They hold it in place, and preventing it from dislocating. Coracohumeral ligament attaches, the base of the coracoid process, to the greater tubercle of the humerus.
Transverse humeral ligament bridges the distance between the two tubercles of the humerus. Coracoacromial ligament running between the acromion and coracoid process of the scapula. It forms the coracoacromial arch.
Can you say me its relations? Superiorly, coracoacromial arch, subacromial bursa, supraspinatus, deltoid.
Inferiorly, long head of triceps. Anteriorly, subscapularis, short head of biceps, coracobrachialis deltoid.
And posteriorly, infraspinatus, teres minor, deltoid. What are the blood supply?
Anterior circumflex humeral artery, posterior circumflex humeral artery, suprascapular artery and subscapular artery. Can you say me its innervation?
Axillary nerve, musculocutaneous nerve, suprascapular nerve. What are its movements and muscles producing them?
Flexion produced by pectoralis major, anterior deltoid, coracobrachialis and biceps brachii. Extension by posterior deltoid, latissimus dorsi and teres major.
Abduction is produced by the supraspinatus, the middle fibers of the deltoid, trapezius and serratus anterior.
Adduction by the pectoralis major, latissimus dorsi and teres major. Internal rotation by subscapularis, pectoralis major, latissimus dorsi, teres major and anterior deltoid.
And the external rotation done by infraspinatus and teres minor. Can anyone say the clinical conditions for shoulder joint?
Shoulder dislocation. The humerus or one of the other bones in the shoulder slips out of position. Raising the arm causes pain and a popping sensation if the shoulder is dislocated. Osteoarthritis, the common wear and tear arthritis that occurs with aging. The shoulder is less often affected by osteoarthritis than the knee.
Rotator cuff tear, a tear in one of the muscles or tendons surrounding the top of the humerus. A rotator cuff tear may be a sudden injury, or result from steady overuse. Frozen shoulder, inflammation develops in the shoulder that causes pain and stiffness. As a frozen shoulder progresses, movement in the shoulder can be severely limited.
Shoulder impingement. The acromion edge of the scapula presses on the rotator cuff as the arm is lifted. If inflammation or an injury in the rotator cuff is present, this impingement causes pain. Guys, we completed the essay question of this question paper.
Yeah, then we will meet tomorrow guys. Okay then bye, see you later guys.